Colorectal cancer, or colon cancer, is the second leading cancer killer in the United States. It doesn't have to be.
I'm approaching my 65th birthday this May, and when I think back to it, I think I was 53 when I first came to see you here.
I remember. It was my first month in medical practice.
Is that right?
Yep, it's over 10 years ago now.
Oh, yes, it has been.
Yes.
So who gets colon cancer? Both men and women can get it. It is most often found in people 50 or older, and the risk for developing colon cancer increases with age.
I came in to see you because I had suspected that I might have something wrong because I had noticed a little bit of blood in my, when I went to the bathroom.
I remember part of our discussion was, Bonnie, you are 53 and it's time to take care of you.
That's so true. I remember that very well.
Yeah.
And I think you did a procedure in your office that day, and that didn't show anything. But then you said, it doesn't matter if I see blood or not. I want you to have your colonoscopy.
That's right.
Seeing your physician every year for your annual checkup is sometimes not enough. Colorectal cancer can start with no symptoms.
I think one of the most important things for people to know is that, everyone, you can have increased risk factors. If you have a family history of colon cancer, if you're a smoker, or if you have any concerning symptoms, certainly you need to be screened for colon cancer. But the majority of people that I try to get to take screening for colon cancer seriously are the people with no symptoms at all.
That's right.
Because you don't have to have bleeding, and you don't have to have any pain or abdominal symptoms or bloating or gas or blood or anything there to be having polyps or cancer that are literally undetectable.
That's
So
true.
the only way that you know for sure that we're not missing something, despite doing the stool tests, which are still recommended, and despite seeing your doctor annually for your routine health maintenance, which is recommended, is to make sure that starting at 50, you're getting a routine screening colonoscopy.
In 2011, nearly 141,000 Americans received a diagnosis of colorectal cancer, and the disease was responsible for 49,000 deaths. Researchers estimate that 1,900 of those deaths could be prevented for every 10% increase in the number of people being screened.
Usually when I first get people coming to my office when you're through your 40s and even in your early 50s, I usually start at 47, telling women, in 3 years, it takes me 3 years to talk somebody into one of those things. So we start at 47 saying, hey, in 3 years when you turn 50, it's going to be time for your colonoscopy. And make a joke about it, but also make sure that we, express to everyone the seriousness of screening for colon cancer.
Yes.
Because you do not have to sit in this chair for long before you are a big believer in talking people into their colonoscopies.
Absolutely.
So starting the first month I was in medical practice, and I think you were probably one of the first major cancers that I diagnosed in medical practice.
Is that
one
right?
of our closest family friends?
Yes.
By talking you into your routine screening colonoscopy.
Absolutely.
If you are 50 or older, getting a colorectal screening test or colonoscopy could save your life.
And did you know, probably weekly and certainly monthly, every month for the last 10 years, we find people with polyps that they find on their screen colonoscopy. They can remove those at the time of their procedure, and if left alone, they could become colon cancer. And that person has been essentially prevented from having colon cancer just by looking and removing any polyps and looking for risk along the way. And some people, those scopes are clear, and then they get 10 years. They don't have to have another one for 10 years.
That's right.
Colorectal cancer usually starts from polyps in the colon or rectum. A polyp is a growth that shouldn't be there. Over time, some polyps can turn into cancer. Colonoscopies can find polyps and remove them before they turn into cancer. Colonoscopies also find colorectal cancer early, and when found early, the chance of being cured is good.
If you're someone with polyps, or if you're someone with a precancer, or certainly if you're someone with a cancer, you want that detected as early as possible because colon cancer is curable if detected early.
Absolutely. And I am living
And
proof
you
of
are
that.
living proof of that.
Sure.
So if you had to tell people any recommendations about what it's like to have a colonoscopy, now that you're an old pro
Yes.
at having these things
Yes.
for your follow-ups and your surveillance, tell us what it's like.
The colonoscopy, I don't remember much about that at all. I think that it's the day before that's a little bit interesting. You have to drink something and a lot of liquid, and that's probably the hardest part of it.
Yeah.
After it's over, you don't have any feelings really at all.
Well, and I tell people about the prep. That's everybody's biggest complaint. The prep
Yeah.
is the worst part.
That's right.
But what I tell people to do is you go get yourself that good book. If you don't have time to read,
That's
get yourself a
right.
folding chair, a big bottle of Gatorade, and that good book that you haven't had time to read. You set yourself outside of that bathroom and you treat yourself to a good book.
That's so true.
And you
I
just have to
agree.
take a few breaks in between.
Yes.
Run in and out of the bathroom.
That's
and before
right.
you know it, you'll have your prep done and ready to go the next day.
Absolutely.
And then the scope itself is a piece of cake.
It is.
You know, I always tell people there are a few times in life where drugs are wonderful. And this is one of them. That's right. By the time they give you those goofy drugs, they could do anything to you and you get careless.
No idea.
Yep.
That's
And then afterwards, you know, you have to have somebody to drive you home, of course, because
yes.
they give you medications, but the medications make it so the procedure itself is not bad at all.
And you have a very good sleep afterwards.
That's right. Best nap you'll ever have.
Yes.
A 2010 American Journal of Preventive Medicine survey found that men and women failed to get screened for colorectal cancer because 1. Their provider failed to recommend the testing, 2. Their own personal lack of awareness about the screening itself, or 3. They believed that the screening tests were too costly. The 5-year survival rate, however, for early-stage colorectal cancer is 90%, as long as the disease is detected while it's still localized and before it is spread.
You know, as soon as I came to see you and we got the whole process of my colonoscopy in the works, I remember being a little nervous because I just had an inkling that there might be something wrong, and it was a fear of something wrong. But I was really pleased because during my colonoscopy they did find cancer, and it was serious enough that I actually went for surgery the following day.
Yeah.
Everybody took really great care of me, and after my surgery I did undergo a period of time, 6 months from, I think I started in December, and I went from December through May, and I had chemotherapy, which wasn't the best time of my life, but it was doable, and I came out without having cancer after that. I was completely cured.
And now you're 10 years cancer-free.
And now I'm 10 years plus cancer-free.
That's right, and a success story.
It is a
And
success story.
one of the biggest things to tell people is that is, even though it's trouble to go through it, that is the
Yes.
result of early detection. And
Absolutely.
if that cancer was not found and that surgery was not done promptly and your chemotherapy done promptly, then the outcomes in regard to treatment of colon cancer are not very good.
That's
So that early detection is the key.
I agree. And you know, I had one grandson before I had my chemotherapy, and now I have 3 more, so I have 4 grandsons now. And I would have missed a great deal had I not
That's right.
had my colonoscopy.
Your risk for colorectal cancer may be higher than average if you or a relative have had colorectal polyps or colorectal cancer. If you are at high risk, if you're 50 or older, visit with your primary care physician today about colorectal cancer screening and colonoscopies.